Hi, I'm Maria Papayawanu-Duick, the host for Between Two Vapes. Each episode, we will delve into different topics, including the science behind vaping, the regulatory process, what's going on, manufacturing, and so much more. Our goal is for you, the consumer, to feel educated and empowered to use your voice against any and all prohibitive regulations when it comes to vaping in our country, in your province, and in your hometown. Today on Between Two Vapes, David Sweanor, my friend, one of Canada's strongest advocacy voices for vaping, is taking the time to chat with me, and he has an important message for all vapers. David, thank you so much for joining me on Between Two Vapes. You are what I like to tell everybody, my friend, my mentor, and I've learned so much about vaping, so it'll be impossible for you to share everything that you've taught me over the course of the last, I think, 5 years. But I just want people to, first of all, get to know you. So if you can tell us a little bit of how you went from tobacco control into supporting vaping.
Well, I mean, I got involved in doing tobacco control work. I was interested in it back when I was on public health issues back when I was growing up in Port Hope, where you happen to be right now. So we share a town. And in fact, I think you're broadcasting from a building my father once owned when he was a relatively young man. And while I was going through a law school and hanging out with people who were going through medical school, I kept hearing more and more about what was actually making people sick. And the leading cause of what was making people sick was cigarette smoking. And I remember talking to soon-to-be doctors about this and saying, well, if cigarette smoking is as big a problem as you say it is, you really ought to be doing more about it. And someone who was thinking much more rapidly than I was in those days said, Sweanor, you don't get it. It's not the first or the last time I was told that. Figuring out why people are getting sick is a medical scientific question. Dealing with it is a social, legal, political question. You lawyers ought to be dealing with it. And they were right. I mean, this is how we make progress on public health issues. And so I went into this with the idea of doing advocacy for public health. What you're trying to do is have a healthier population. So from the beginning, and this is like 40 years ago almost, it was a matter of anytime you've got a product or a service or an activity that's causing death, injury, or disease, you've got 4 ways of intervening. You do things to try to get people to never engage in the dangerous activity. So if you said, hey, David, I'm thinking of taking up paragliding, and I plan to do it while intoxicated, I would try to talk you out of that. We can do things to get people to never start. We can get people who are doing something to stop. We do things to protect third parties. David, I really like throwing a javelin. Well, don't do it in a crowded park, Maria. And the 4th thing we do is that we try to reduce the risk for whatever somebody's doing. It's not that I changed. I mean, we were trying to do risk reduction work in what I was doing from the beginning, because that's just what you do. And it's a huge part of everything we've done to reduce the risks of just a whole range of things. If you want to understand why cars don't kill people the way they used to, why planes don't crash the way they used to. We've seen from Steven Pinker's book, Enlightenment Now, when we use the principles of the Enlightenment, when we use reason, when we're humane, we find ways to reduce the risks of anything we're doing. And here it just seems so obvious that the risk was because we had this really dirty delivery system. People were getting nicotine by sucking smoke into their lungs. And we knew by the 1970s, even before I got started in this, that people were smoking to get nicotine. They were dying because of the smoke. So even in the 80s with the Tobacco Products Control Act, I drafted a section that was a harm reduction section. It was to give a relative advantage to products that were less hazardous than cigarettes and would be used in place of cigarettes. And of course, the cigarette companies attacked that legislation. They did constitutional challenges. They eventually managed to kill the legislation, not on that provision, but on others. And at the same time, I saw a lot of my colleagues, people who should have been doing public health, who saw this more as a moral quest, like they were fighting sin rather than trying to save lives. And they didn't want to have easy outs because they wanted to essentially tell people, here's how you have to run your life. And I found that very, very difficult because the difference between somebody saying, I can empower you to make better decisions about your own health. And somebody saying, let me tell you how to run your life is huge. And the first is public health and the second is moralistic. So, I watched this change happen where a lot of people who really understood public health and were working in tobacco control had lots of options. They had other jobs they could move to. A lot of the people who stayed in the field were people who didn't have those sorts of options. And it's because they were fighting sin rather than fighting for public health.
When you look at public health, there is that moralistic point of view. Is it the preachers and the bootleggers that you've used as an example?
Yeah, that's right. Bootleggers and the Baptists. So that, during in discussions about alcohol prohibition, there's one thing that bootleggers and the Baptists can agree on is we need to close the liquor stores. The Baptists see that as a moralistic thing to prevent sin, and the bootleggers see it as a business opportunity. We've seen an awful lot in the tobacco control space that works like that, where one thing cigarette companies and a lot of anti-tobacco people can agree on is we don't want to have alternatives to cigarettes. Well, from the standpoint of the abstinence-only people who see this as a moral issue, they think that's going to prevent people from using nicotine. From the standpoint of cigarette companies, it preserves an incredibly lucrative business, and that cigarettes are, by far and away the most profitable consumer product out there because of all sorts of things, including the sort of laws that we've had in place that prevent competition.
Health Canada, we've got their 3-point plan. So the first step is the nicotine cap, and then we move on to the flavor ban, and then we have taxation. So in between two vapes on this series, we want to really empower consumers to use their voice. And for the submission of Health Canada, you teamed up with 3 consumers and wrote a submission. We have that on the Rights for Vapors website. Why was it important that consumers were part of that submission that you put together?
For various reasons. I mean, certainly, if we look at the practice of public health, an absolutely key part of it is to empower people to make better decisions about their own health. And we talked in the sort of documents that are accepted in mainstream public health, like the Ottawa Charter on Health Promotion, which is accepted by the World Health Organization and everybody else. We talk about understanding people's lived experience. I mean, meet them where they are. We're trying to empower people to make better decisions. It's not about dictating to them. You want to listen to the people who know those things. And in fact, we live that now on other areas of public health. So if we're working on something like opioid policies, we want to understand, what is the situation of people who are using opioids in Canada? How do you prevent the fentanyl-related deaths? Where are they coming from? Why is this happening? What do they have to say? So the empowering is really, really important. And being able to get the voices of vapors out there, because I think what we've seen is the people who see this more as a moralistic issue, like they're fighting sin, they're fighting evil, have tried to frame this like vaping is the problem, rather than, no, vaping is the solution to a really huge problem. And we've ended up with this absurd situation where Health Canada acknowledges that cigarette smoking is killing over 40,000 Canadians a year. I think in the documents they put out with the efforts to limit nicotine, they say 48,000. I mean, when you think about that, 4,000 of us every month dying as a direct result of cigarette smoking. The disease is caused by the inhalation of smoke. And they deal with that not by saying we need to use the existence of far less hazardous products. I'm sure most of your listeners have heard that prestigious bodies like the Royal College of Physicians in the UK say, based on all of the evidence that we have seen, vaping is unlikely to be any more than 5% as hazardous as cigarette smoking, and is probably less hazardous than that. But instead of saying, here's how we turn this to an advantage, it's looking at the solution like it's the problem. And we need to find ways for Health Canada to cut through all this moralistic stuff and look at the opportunity we have, to just, save so many lives, extend life so dramatically, to have one of the biggest public health breakthroughs we've ever had. And then go back to the sort of country we used to be, 20, 30 years ago, where we were setting precedents the rest of the world was following because we were so good at reducing cigarette smoking. And we could get that back by getting the sort of creativity that we used to have, the pragmatism that we used to have on the things that we were doing back in the 80s and early 90s, before a lot of this became much more bureaucratic, moralistic, and far less effective.
So Health Canada has this plan, and they keep talking about it, 5 by 2035. Now, do you think that if they continue to marginalize smokers and continue to tell us quit our way or die and remove access from this product, are we going to hit that target?
Of course not. I mean, we've had these things come up before where governments will pick, or health agencies will pick some sort of number and say, this is what we're going to get. So I lived through things like smoke-free 2000. You know, by the year 2000, nobody's going to be smoking. Lived through stuff where they say we're going to reduce cigarette smoking prevalence, you know, by some huge number within 5 years or 10 years. They pick a number, then they don't do anything about it. So here they make that statement, and they need to be held to account to say, tell us how. Don't just say you're going to do it so then 2035 somebody else is in charge and they'll now come up with some plan for 2050. Meanwhile, you've got over 40,000 Canadians dying every year because of not just the dirty delivery system for nicotine, but the failure of government imagination to do something about it when we have known for decades how to deal with it. You know, we've known its delivery system. This is not rocket science, right? You know, you say if you look at the history of all the thousands and thousands of research papers on the diseases caused by cigarette smoking, you can sum it up in 4 simple words. It's the smoke stupid. It's the smoke stupid. It's the smoke stupid. I mean, deal with the smoke. And here we've got something that can deal with the smoke. Health Canada says we've got this goal to reduce smoking by a whole lot. And toward that goal, we're going to get rid of the alternatives to smoking tobacco. We're going to tell people that, yeah, we know that smoking cigarettes is addictive. A lot of people are self-medicating. A tremendous number of people are never going to be able to get off this before they die, and that they get their nicotine from something else. But we're going to ban those alternatives, or we're going to make them consumer unacceptable. We are going to do to the things that are currently working, like vaping, what was done to things like the nicotine replacement products. We're going to make sure they don't deliver very much nicotine. They don't deliver it very well. They don't deliver it in a consumer acceptable way. We're going to make it hard to get. We're going to scare the crap out of people about nicotine so that they're misinformed and can't make an informed decision. And look what happened. You know, we've had no innovation in that field for 30 years. We have very few people successfully using the products. They were put at a huge regulatory disadvantage, and cigarette companies keep laughing all the way to the bank. You know, the very moralistic, just say no approach to drugs is gone now. Our government's talking in terms of risk reduction for people who are using even illicit drugs. And you get to an issue like this, and they're looking at, let's simultaneously have a goal for something really significant while working very hard to prevent the things that can actually cause that to happen. So, you know, let's get somewhere as fast as we can, you know, in your car while I keep my foot firmly on the brake. You know, it doesn't work.
One of the things that I hear as an owner of a vape shop is I'm a tobacco company. That's what I keep hearing all the time. So my voice is minimized because, you know, I profit from non-tobacco products and helping people quit smoking. So it's important for me as a shop to build a platform and encourage and empower my customers to speak up. Like, what would you tell consumers? Like, first, why is their voice important, and what ways can they use their voice?
It's their lives that are on the line. They're the people we should be listening to. We do that on other things when we're trying to understand what can we do to reduce any sort of death, injury, or disease. Who are the people most at risk, and what do they tell us? What can we do working with them? They ultimately are in charge of their health. They have agency. They should have agency. And we should be looking at ways to empower them. When we're doing that, other things start to fit together. Like, isn't it amazing that because they're already spending so much money on cigarettes, this can be a self-solving problem if they can simply shift even part of that expenditure to buying vaping products. I mean, they're cheaper than buying cigarettes. They don't kill you. They essentially solve the problem with cigarettes. And it spurs technology to come out with ever safer, ever less addictive alternatives to cigarettes. So things like vape shops become really important. You can look at them as self-funding, effective smoking cessation clinics. We want to have those sorts of things. And the people who say somehow a vape shop is the tobacco industry, or a vaping company is a tobacco company, or vaping products are tobacco products. I mean, it would be right out of Monty Python if it wasn't for the tragic consequences of that sort of misuse of logic and language. I mean, by any logical analysis, vape shops are hugely valuable in helping people transition off of cigarettes. And when we look at the sorts of things Health Canada has somehow been pushed toward doing, and I think that's because they're hearing the voices of a lot of the abstinence-only people, the people who see this as a moral quest, they're fighting evil, the people who think science doesn't really matter unless they can distort it in a way that fits their moralistic agenda. And I say that, I mean, with tremendous animosity, because many of these are people I know, I've worked with. I mean, they know how many people are dying because of cigarette smoking. And they're not stupid. I mean, they've got to understand that what they're doing is incredibly counterproductive and helping cigarette companies because they're attacking the alternative products. Health Canada, that's targeting vaping products, pushed by the abstinence-only people, are doing almost nothing about cigarettes. And you consider, what's the public understand about that? And you see it in surveys. People think vaping's at least as bad as smoking. Many people think that vaping is worse than smoking. Well, if you look at the environment, if you look at what Health Canada is doing, when you look at some of these idiotic anti-tobacco people who think that anything nicotine needs to be attacked, they're reinforcing that message. They're keeping people smoking cigarettes because the environment that they have shaped has communicated the message that smoking is a better alternative. So how do you get people to change their behavior? How can Health Canada expect people to get off cigarettes when they're sending messages that are consistent with the view that these low-risk alternatives are actually higher risk? Because of the presence of vaping products and the technological improvements in lots of areas of nicotine delivery, we're going to facilitate the greater availability of these products. We are going to facilitate people getting truthful information about these products. And remember, Health Canada said they were going to do that. They said that shops like yours are going to be able to give people truthful information about relative risk, and they put those regulations on hold. So you can't tell people, under their law, you can't tell people how much less hazardous vaping is, even though that information will save lives, because Health Canada is putting its efforts into doing things that stymies vaping and keeps people smoking cigarettes. For consumers, for the people who are vaping, for those who care about people who are smoking cigarettes, I mean, how do you look at that without getting angry, without getting start craving mad that look at what they're doing? And, again, when, you're broadcasting from Port Hope in my hometown, I've passed the age where I've lost friends I went through school with to things like lung cancer because of their smoking. They'd be alive now if they'd been able to get their nicotine in another way. And thousands more people are joining them every year, completely unnecessarily, because of a dirty delivery system that is in effect being protected by the very agency that's supposed to be protecting the health of Canadians. So, why should consumers speak up? They should speak up because their lives are on the line. The lives of thousands of other people are on the line. And the credibility of governments and government health departments is on the line. The government health departments ought to be giving us good information on things like vaping. When you start distorting those things for an ideological agenda, the cost is huge. And if you start saying that black is white, up is down, and a vape shop's a cigarette industry, you just lose that credibility. To say it's a tobacco product, I see this as some of the surveys where they ask people, do you smoke vaping products? And I think, well, that's sort of like asking me if I drink cheese. I mean, it just indicates that the person asking the question doesn't know what the heck they're talking about. And to label the products the same, I mean, so are we going to call apples junk food? Because some people use it to replace their junk food. They're a fundamentally different product. basic marketing and public health principles would tell us you want to encourage people to move to less hazardous products. Use everything at your disposal. For heaven's sakes, don't mislead them about it and then mislabel the low-risk products as if they are high-risk products. I mean, that's pretty simple stuff.
Yeah, but it doesn't seem to be easily comprehended by Health Canada at the moment.
Well, I think there's a lot of people, I mean, we're slugging off Health Canada. I think there's a lot of people at Health Canada who totally get it and are truly interested in public health. I think we have a problem in that there's other people there who don't. They see this in ideological ways. They think they're battling evil. They think somehow the vaping industry is controlled by the cigarette companies. They think cigarette companies are doing really well because of vaping. I mean, it's all complete nonsense that, you know, any look at the evidence is going to tell you. But you've got people who have, you know, these fairly warped ideas. We need to counter that.
Thank you so much for being on this new web series that we've done, Between Two Vapes.
Well, I'm really pleased the initiative you show on this, Maria. The drive you've had, it makes a difference. And I know how frustrating it can be to be involved in social change because I've lived it as well. So I welcome anybody who's involved in it. And this really is the way that, you know, we make for a better world. So yes, speak up. Let your voice be heard. Let's see if we can get to rational policy.
Thank you for watching Between Two Vapes. If you want to learn more about our show, stay up to date with vaping news, or get sneak peeks of our upcoming shows, head over to our website or follow us on social media.